Welcome, my mental health champions, to another time with J. Kelly, your psychiatric mental health nurse practitioner. If you're new to this channel, my name is J. Kelly, and we share everything that affects your mental health well-being and to get out the stigma that people have about mental health. So today we're going to be talking about some pharmacological ways we use to manage anxiety. So we've been talking about anxiety, we talked about non-pharmacological ways, but today we're going to be talking how we use medication prescribed by healthcare professionals to target your symptoms of anxiety. Remember that this has to be prescribed by healthcare professionals. Why? Because they will have to assess your specific need. They will have to consider potential side effects. They will have to monitor you for your treatment to see your response to that particular medication. And this involves so many classes of medication. And today we're going to talk about some of these classes of medication that we call it the go-to ones that we use for anxiety. The first line of defense for anxiety that we normally see in practice or we use in practice is called the SSRIs. SSRIs stands for selective serotonin reuptake inhibitor. So this medication target that particular neurotransmitter to be able to increase your mood and boost that transmitter so that you will get out of those symptoms you have been going through. And some of these we have like Zoloft, which we also call sertraline, or which my nursing mothers, we normally call it squaltrine, because it can be used by our nursing mothers without fear of the baby having those side effects, having to go through that medication as well. We have things like Lexapro, Paxil, Prozac. These are just some of the medications we use, but I want you to know that these medications increase to a certain level, but it takes about 2 to 4 weeks for you to be able to see the benefit of this medication. So if after 4 weeks we realize that your symptoms are still as severe as they are, you might maybe need an increased dosage, or we need to add something else to be able to target your symptoms. So that was the first line of defense that we normally use. The second class of medication that we use in practice, or that you will hear us talk about, is called the SNRIs. The SNRI stands for serotonin norepinephrine reuptake inhibitor. So this class of medication does not only target your serotonin, it also target your norepinephrine. And all of these are neurotransmitters in the brain that with an imbalance of those, you have those symptoms coming at you. And examples of this medication, you see like Effexor, you see like Cymbalta, but understand that these medications, they have triple uses, they have quadruple uses, they have so many uses. So you can be taking Cymbalta for fibromyalgia, you be taking Cymbalta for something else, but we also use Cymbalta at certain dosaging to be able to target your symptoms of anxiety. And with this, we will move on to another class of medication I call the IMs. The IMs, because the names end with like AM and things, that was my way of remembering those names in grad school. So the IMs comes from the class of medication we call the benzos. That's a big one, the benzodiazepine. People love the benzos. The benzos, on the other hand, is a class of medication that is fast acting, and it should be used on an acute situation. It should be used short term. I don't like using it on the long term because it has the potential for dependence. It has also that sedating effect. So on the benzo line, we see things like alprazolam, we see things like lorazepam, we see things like diazepam. And this medication, they target your GABA, your gamma aminobutyric acid. I'm sorry about that. That's what these benzodiazepines, they target in your brain, and it should be used in specific situations. So please don't go telling me, hey, I need my Xanax, I need my this because I have been taking it for too long. Right now, we are trying to wean people off the benzodiazepines because of all this potential for dependence and the sedative effect, especially in the elderly. It is not something you want to use in the elderly for long term because it will cause a lot of falls. It can cause a lot of falls and cause other complications in their health care. That's why all these classes of medication, regardless of your health situation, the healthcare provider will first of all assess your history, assess some medications you're already taking, so that we make sure there is no interaction with this medication. We will make sure it is targeting specific symptoms that we want to treat. And from this, there's one particular medication, which is a serotonin partial agonist we call Buspar or Buspirone. So many people, you see so many people taking Buspirone because it's a serotonin partial agonist. And this particular medication is normally prescribed for generalized anxiety. And unlike the benzos, this medication is not, it doesn't have the potential for dependence. Now we will move to another class of medication. I love for performance anxiety. I love for people that have a little anxiety moment to stand in front of people, to talk, or performance anxiety. So this one, we call it a beta blockers. Beta blockers is normally used for blood pressure. It's a blood pressure medication, but we use a low dose of this medication to target that heart rate that is high, adrenaline is pumping, your heart rate is going, you're trembling, you're getting anxious about a particular situation. A low dose of Inderal, a low dose of propranolol will go a long way to help you calm your nerves down, to take that adrenaline level to the level where you'll be confident about yourself. You say, hey, I got this. And you'll be like, I'm already taking propranolol. Yeah, you might be taking propranolol already for your blood pressure, but guess what? It has that beneficial effect on that anxiety performance part of your life that you feel like I can't go to the crowd, I can't do this. So we use beta blockers for particular situations of anxiety. So again, I want to make you understand that these classes of medications are used in conjunction with therapy. So certain moments we will have to associate therapy. That's when our counselors, our therapists comes in. We do things like cognitive behavioral therapy to be able to help you have coping mechanisms, just like we talked about in our previous video on non-pharmacological ways on how to go about coping with your anxiety. So please, again, this is something that has to be prescribed by a healthcare provider. So if you're going through all these moments, don't be like, hey, JK said I could take this. No, you go to somebody who is specialized, who knows how to manage your healthcare problems, and we'll be more than happy to assist you. So if this is your first time again on this channel, I want you to go and like the video, subscribe to the channel, and share with your fellow friends and family so that you will not miss any content that is shared. And if there's any mental health issue that you want us to talk about in the channel, put it for me in the comment section. You can inbox me and I'll be more than happy to share that with the population and the whole mental health family. So I want you to know today that you are unique in your mental health journey and you are not in this alone. You have me, you have people behind you that are rooting for you to say, hey, you got this. This does not define who you are. You got this. So peeps, thank you again for liking and thank you for having me. Have a wonderful day and peace out. Take care of yourself for me. Thank you.